the next 5 years, Joondalup Health Campus will go through an exciting transition. Our vision, to grow with our community to provide excellent healthcare, has set us on a course of significant change. Our strategic intent, 2017 to 2022, explains how we must evolve on many levels to achieve this vision. This video will help you to understand where we're headed and how you can be part of this important and historic transformation.
The people in the northern suburb of Perth deserve to have a high-quality tertiary facility in their local community.
There's also changes in patient demographic and patient needs, and we need to be keeping an eye on what those changes are and making sure that the services that we're delivering are appropriate.
Our role, to me, extends beyond the walls of the hospital, and it's actually far more about keeping the local population healthy. Across a number of areas we need to grow what we're doing. There's still a large percentage of the patients that drive down to the centre of the city when they need healthcare, and that shouldn't be the case, that shouldn't be necessary.
Growing with our community means growing, not just in a hospital sense, not just in a number of beds sense. It means growing with our relationships, it means growing with the people who use our service here.
This process requires all of us to align our thinking and work together towards our vision.
Our strategic intent is quite complex, and if we aren't aligned, it's going to be very, very hard to deliver to the quality and to the standard which our community expects. The strategic intent has 6 enabling plans that support its implementation. These enabling plans are quite high level at the moment, and year by year we'll have detailed operational plans.
The enabling plans are the Clinical Services Plan, People and Culture Plan, Safety and Quality Plan, Infrastructure Plan, Community Services Plan, and the Specialty and Departmental Plans. These enabling plans are backed by our commitment to the Ramsay Way.
The Clinical Services Plan is really important to us here. It will define what services we offer, it will define what services we don't offer as well, and it's about communicating that to the wider public and them understanding what we do here and what we can do here.
It's not just thinking about what the breadth of the services that we're providing, but we also need to be thinking about our capability or the level to which we provide those services for our community.
We believe that the transformation of our hospital has 5 key challenges. The need to change care delivery models by identifying and designing new systems to address ongoing care management. Transitioning to tertiary level service in some specialty areas. Growing our infrastructure to support the increasing population. Meeting technology and data sharing requirements. And the need for a cultural transformation to shift us away from an acute care vision to one that has the broader goal of managing health and wellness in the community.
We need to train people to think differently about how they deliver care. Traditionally in healthcare, carers have seen themselves as being there to look after patients. What we want is to have a more empowered patient and a patient being involved in their healthcare, and that takes that requires our staff to change their mindset just as much as it does for our patients to change their mindset.
In response to the challenges that we've got in the community, we have to be very, very committed and very, very organised. It's a complex piece of work. We all have to be aligned, and a strategic intent provides that alignment.
Over the next 5 years, our strategic focus areas are patient services to deliver innovation and excellence in healthcare. People and culture to ensure we have a highly skilled, caring, engaged workforce. Safety and quality, because that's our business. Infrastructure, so our facilities can deliver patient-centred care. Partnerships, because effective collaboration underpins our services. And resources, to ensure our hospital is successful and sustainable.
It's really important to involve the frontline staff in the strategic planning and strategic intent.
There's no one person who has all the answers to this, and it requires lots of people with lots of different opinions and lots of ideas for us to move forward with this.
As a staff member and a recent patient, I think that excellent healthcare means to start with feeling welcomed and listened to, understood, the feeling of being safe. I think it's the individual care that makes a difference.
Excellent healthcare to me means an easily accessible facility for patients to come and receive wonderful evidence-based healthcare with a brilliant culture and brilliant staff.
A quality experience should be making the patient journey as comfortable and as smooth as possible.
The patient should say that they have overall a good experience about the hospital, that they were well looked after, the environment was clean, it was comfortable for them, and just a professional service.
So to me, a quality patient experience, I think, incorporates that, I felt listened to. They felt listened to, they were respected, and it's also a non-judgmental environment. They walk away from the hospital thinking, I know what the care plan is about, and they've got a clear pathway.
The way we make patients feel, apart from all the care they get, but it's that how we leave them feeling, that good feeling of the loving care they've got while they've been in hospital.
Quality experience would mean that the patient is really content with their healthcare outcomes and their stay in the hospital.
Excellent healthcare to me means providing a service that's on par with other hospitals of the state, nation and globally.
Our next steps are critical. It's for us to have our staff and our stakeholders engage with us. Our staff need to deliver the vision, but also our stakeholders need to understand what we want to provide to meet the community needs.